Living Labs work, I'm looking specifically at the healthcare sector. So one of the areas that my team's been working on this week, in this last 6 months or so, has been gathering international information on health indicators and energy indicators. And what we're trying to do is challenge the way that we report on the energy indicators for hospitals and aged care centres, for example. So to get something a bit more complex or a bit more informative than just kilowatt hours per bed or kilowatt hours per square metre, etc. So that piece of work is currently underway, and we expect to have a report on that. The aim of that is to try to find alternative ways of being able to quantify the benefits of energy efficiency and renewables for hospital and aged care sectors. So it's not just reducing kilowatt hours or reducing CO2. It might also be, can you link that to enhanced staff welfare or reduced hospital stays, etc. So trying to find mixed key performance indicators that might have health and other benefits, as well as the kilowatt hour or energy cost benefits. So our two living labs in Queensland are Fernhill Aged Care Centre, and we have Bolton Clark's asset manager here online with us, James Mantis, and Queensland Children's Hospital. So we have their main facilities management person, Bruce Bonney, also online with us. So in both of those living labs, we are currently in the process of testing 2 new innovative technologies in each of those labs. So in each of those labs, we have what I would call a machine learning or optimization software technology that we're testing. How can we assess how particularly the HVAC systems are performing, how can they be optimised, etc. So we're testing 2 different technologies, one in each of those living labs. We're also testing some other technologies. So in Fernhill, we're looking at the impact of what's called honeycomb blinds or insulated blinds on reducing the heat demand into residents' rooms, which then impacts on the air conditioning. And at the hospital, we're looking at a technology, in essence, graphene-dosed coatings for external condensers to improve their heat rejection capabilities. So from a codes and standards point of view, a couple of things come to mind to our team. One is, say, regarding testing the impact of, say, graphene-dosed maintenance on external plant for HVAC systems, that there is no standard that we know of how to test installed HVAC systems to determine are they meeting their COP as designed specifications. So how do we actually test the impact of improvements or test the impact of non-maintenance, etc., on installed HVAC systems? The second sort of codes and standards thing that comes to mind is neighbours. So both the hospital, the hospital through Queensland Health have been involved in neighbours for a while, but through the Living Labs we've managed to connect Bolton Clark with the neighbours team for the development of the aged care tool. So Bolton Clark have provided some Queensland data that neighbours were missing as part of their database for neighbours, and neighbours will be trialling their tool in one of Bolton Clark's Brisbane facilities over the next couple of months. So a question about neighbours, I guess, is what is the purpose of such rating tools, and therefore what data do you need, and how can the iHub help neighbours, and how can neighbours help the iHub, and and the clients in order to get the best benefit for both. So one of the things is that facilities aren't always keen to make their neighbours' ratings public, particularly if that might present a political or a company reputational challenge. And how reliable are the findings as well. And then from a research perspective, we can't get access to the de-identified data that neighbours might have on different building sectors to be able to determine what's working well or not working well, and therefore how can we advise on through the iHub on better HVAC optimisation or renewable energy options for those types of buildings. So that's all I was going to sort of raise with you. I would first of all ask whether James from Bolton Clark or Bruce from the Children's Hospital want to add anything to that.
It's James here, Wendy from Bolton Clark. Not really to add, essentially to reinforce that Bolton Clark's interest. We have a large portfolio of aged care assets. A lot of them are legacy stock. We also have a substantial capital works program. So the lessons learned and what we can harness out of the Living Labs will provide significant insights in terms of how we can better manage our energy demands, our carbon footprint, and the solutions that we provide for our residents and staff. We have this convergence where our aged care facilities are both residents' homes, but also at the same time they're commercial places of business for our staff. So they at times have conflicting demands, but increasingly it's about the focus in terms of providing a consumer-centered environment that allows residents to dictate their own comfort and their own modalities in terms of how they live within these facilities. So I think the Living Labs will be a great platform from which we can harvest data to then put into future developments.
Yeah, thanks, James. Bruce, do you have anything from the hospital's perspective you'd like to add?
Yeah, I'm keen to see the linkage between so our operations people collect data, but it's very much a lagging they're all lagging indicators, and they're usually length of stay, emergency length of stay, overnight bed occupancy, number of patients being treated as in hospital, in the home, those sorts of things, and there are some numbers out there around kilowatt hours per occupied bed day and that sort of thing, but again tends to be lagging rather than leading. And I'm sort of keen, and the two groups are separate. So the energy side of stuff sort of sits with me, and the operations side of stuff and the clinical stuff sits with the operations people and clinical people. And it'd be good to try and get the two to marry up together. We do have a sustainability person who's now been appointed permanently, and she's keen to tap into neighbours, and I'm keen also to just see what sort of benchmarking we've got around. We've engaged a company by the name of Buildings Alive to do some work for us as well in terms of collecting data, looking at one of our buildings as a trial, and potentially getting into some back-end analytics on energy usage. Something that's a bit different. There's a few organisations out there that do rules-based analytics. Buildings Alive is a little bit different. They're also Australian-based, so we were keen to sort of tap into that as well as an organisation, and sort of try and get either some sort of digital twin moving or something along those lines, and then try and see if we can merge that data together. But it is early days. We would have had graphene paint in by now, except lockdown and COVID, we were ready for a site visit. The guys have been inducted and ready to go, and I've got the kitchen all lined up. They're happy for us to take their condensers off so we can do the work, and that would have been this week. So hopefully in the next couple of weeks we'll be in and on site and start measuring energy usage before and after and during.
Yeah, so thanks, Bruce. And yeah, I should also say that the research team has been continuing to do baseline performance and PV output from the aged care centre compared to their operational energy consumption, etc., etc.